Bismillahirrahmanirrahim. Okay, again, Assalamualaikum warahmatullahi wabarakatuh and a very good morning. Today we are going to learn about a new chapter in anatomy and physiology, a very important topic, okay, where um, I can say this system is the most important topic in the anatomy and physiology course lah, respiratory system. I do really hope that all of you can pay attention during the class, at least can understand about the organs uh, that related or involved in the respiratory system, and also how the breathing mechanism and different types of volume we've got, air volume we've got inside our thoracic cavity. Okay, right. Okay, let us start. Okay, organization of the respiratory system. So basically, we can divide it into two main divisions lah. The first one is we call as a structure organization, and the number two is functional organization. Okay, so when we talk about structure, it means about the anatomy, while the functional means about the physiology. Okay, from the structure organization, we've got upper respiratory tract and lower respiratory tract. Okay, upper respiratory tract include nose, nasal cavity, pharynx until here, larynx. Okay, and then we've got lower respiratory tract. Okay, lungs lah, bronchus, trachea, bronchioles, and then we've got capillaries here, where there is a alveolar duct and alveoli, where the what we call the exchange of gases, mainly carbon dioxide and oxygen, mainly occur here in alveoli. Okay, in the alveolar duct ni dia punya duct ni lah, dia punya tangkai ni, while alveoli ni singular we call it as alveolus. Okay, because of there are clusters of alveolus here. Okay, many alveolus, we call it as a alveoli. Okay, so in a functional organization, we've got two divisions here. The first one is conducting zone, where it conduct the gases, okay, the oxygen and also the carbon dioxide are going through this passage. And then you've got respiratory zone. The respiratory zone is where the exchange of gases occur. Okay, in the terminal end of the bronchioles. Okay, we've got it respiratory bronchiole in the lungs, and here in the alveoli there will be capillaries. Okay, from the heart. Okay, we've got a pulmonary artery and pulmonary vein from the artery, and then they form the pulmonary capillaries, and then pulmonary vein. There will be exchange of gases here between the lungs component and the heart component. Okay, so this is the organization of the respiratory system. Okay, respiration functions of the respiratory system. Okay, number one is the oxygen and carbon dioxide exchange between blood and air. Respiratory and cardiovascular systems work together to deliver oxygen to the tissues and remove carbon dioxide. Okay, mainly our body, the carbon dioxide will be expelled out through the CVS, okay, from the tissues. The carbon dioxide that we do not want to use it, okay, it will go through the cardiovascular system first, and if you want to expel it out, it must be through the what we call here is a respiratory system. So there must be an exchange between the gas conduction system and also the blood conduction system. And the gas conduction system, we call it here as a respiratory system, while the blood conduction system here, we call it as a cardiovascular system. So basically, the exchange of gases occur at the terminal bronchioles dekat alveolar duct ni, where there will be an oxygen and carbon dioxide exchange. Okay, number two, speech and other vocalization. Okay, we've got a vocal cord here in the respiratory system as well for speech conduction. Okay, and then we've got a sense of smell. Okay, through the we've got the smelling sensation and the receptors present in our nose. Okay, and then we've got a effect pH of body fluids by eliminating carbon dioxide. For your information, carbon dioxide in our blood present in a form of what we call as a bicarbonate. Okay, bicarbonate it is uh, uh, and carbon dioxide actually it will cause, when there is an accumulation of high carbon dioxide inside our blood, okay, it will cause increase in acidity, and it will affect the pH lah. Okay, so metabolism in our body really need a kita panggil suitable pH to work normally. But then if the pH will be affected, either too much alkalinization or too much acidic pH, okay, the metabolism will be affected as well. So respiratory system play an important role to eliminate CO, so that the acidity of our blood can be reduced, so it can be in a normal pH. Okay, so breathing creates pressure gradients between thorax and abdomen that promotes the flow of lymph and venous blood. Okay, when we breathe, actually the movement of the diaphragm and intercostal cage, okay, basically it will create a pressure, okay, where this pressure will promote the flow of lymph and the venous blood as well. And lastly is the breath holding helps expels abdominal contents during urination, defecation and childbirth, or we call it as a Valsalva maneuver. Okay, when we want to urinate or defecate, or in delivery of childbirth, okay, basically we will do what we call dalam bahasa Melayunya, we call it as meneran, where we create a high abdominal pressure, okay, high pressure inside our body to expel out all of these things lah, okay, either urine or our defecation punya bahan perkumuhan, or the childbirth as well. So again, it is due to combination of the movement of our diaphragm and the intercostal cage, where it will create this what we call high pressure inside our body, and then it will help in this Valsalva maneuver. Okay, right. So any question for now? Boleh faham dia punya organisation and also the functions of respiratory system.
Boleh.
Okay, good. Okay, organs of the respiratory system. When we talk about anatomy or a system, okay, system it is a combination of uh, organs, okay, which work together, okay, to do the same function lah, and in this case is the respiratory system or respiratory function. Okay, so organs of the respiratory system, mainly we've got nose, and then pharynx, larynx, trachea, lungs, where at the end or the terminal passage is the alveoli, okay, and then we've got bronchi as well. So if we look at this picture, here is a nasal cavity, okay, where from the nose external nest or nostril. Okay, dalam bahasa Melayunya we call it as a lubang hidung. And then we've got to this nasal cavity. Okay, nasal cavity ni we call it also as a nasopharynx lah. Usually we call it depan nasal cavity, inside here is a nasopharynx. And then from the mouth, okay, it will go inside. This is a oral cavity. Okay, so the nasal cavity and the oral cavity here. Okay, pharynx, we've got two, nasopharynx and oropharynx. Okay, all of this we call it as a pharynx. Okay, this is oropharynx. And then here is that after pharynx, we will go to the larynx, and we call it as a larynx. And then from the larynx, there will be trachea, okay, and then bronchus. Okay, this is a right bronchus, and this is a left bronchus. And we go to the lung. Okay, lung, here we call it as a base of the lung, and here we call it as a apex of the lung. Apex maknanya dia macam ada tajam lah, bucu. It cuts an edge here, such a cone, macam cone, ujung atas tu we call it as an apex, and then here is a base, and then here is the base of the lung. And okay, here is a diaphragm. Diaphragm is also play an important role in respiratory system, where the contraction will cause together with the intercostal cage, it will create a pressure. Okay, where in a respiratory system, a mechanism of breathing, the air, the induction of air from outside will go in. Okay, due to different pressure lah, from positive pressure to the negative pressure. Okay, so basically this is these are the organs of the respiratory system. Alright, means that all of these play an important role in the respiration. Okay, so the first go to the nose. Okay, so here basically nose we can divide it into here ala and apex and filtrum. Okay, so this is some kind of memorization lah, kena remember the parts tu. And then inside our nose we've got a combination of bones and cartilage. Okay, the difference is between bone and cartilage, the bone is more compact, it's more the hardened in nature. Okay, while cartilage is more is softer. Okay, and then we got here is septal cartilage, where it divide into right and left, and then major ala cartilage here, and then septal cartilage as well. Okay, okay, the nose muscular passage from nasal cavity to larynx. Okay, as I have explained before. So what are the functions of the nose? First, it warms, cleanses and humidifies inhaled air. Okay, it's like we call it what we call macam penapis lah. It's like a penapis where it will tapis any dust atau any dirts. Okay, so it also detects odors in the extreme. Okay, for the smelling purpose. It serves as a resonating chamber that amplifies the voice as well. Okay, so three regions of the pharynx nose extends from nostril, okay, daripada lubang hidung lah, to a pair of posterior openings called the posterior nasal apertures or guana. So facial part is shaped by bone and hyaline cartilage. Okay, superior half nasal bones and maxilla. Okay, basically muka kita ni, okay, kalau kita tengok skull, yang apa kita nampak tu adalah daripada bone sahaja, tapi sebenarnya ada lagi cartilage yang bersambung dengan bone tersebut yang membentuk muka kita lah. Okay, superior half nasal bones at maxilla, ini maxillary bones. Okay, belakang pada nose ni. Okay, inferior half lateral and alar cartilage, inilah. Okay, alar nasal flat portion at the lower end of nose shaped by alar cartilages and dense connective tissue. Okay, Okay, so basically dekat bahagian depan ni, alright, yang lembut ni, terasa lembut hidung kita ni. Okay, it is formed by cartilage and also connective tissue lah. The bone kat depan ni tak ada bone. Okay, semua adalah cartilage saja. Yang bone ni start daripada atas ni lah, kat nasal bone dalam maxillary bone. Alright. Okay, anatomy of nasal region. Okay, basically untuk hidung ni, hidung ni daripada atas ni sampai ke bawah lah. It is formed by root, we've got bridge, dorsal nasal, nasopharyngeal angle. Here is apex, alar nasal, nares nostril, nasal septum. This is filtrum, alar nasal, sulcus. Okay, inside we've got here, this is a nasal bone, as I have mentioned before. Okay, the front part of our nose basically made from cartilages and also dense connective tissue. Okay, so here is a dense connective tissue. So the more hardened part is here is formed by the cartilage. Okay, septal cartilage, the lateral cartilage, minor alar cartilages. Okay, there are so many cartilages formed here. Okay, and this is a dense connective tissue. So basically anatomy of the nasal region ni terdiri daripada bone, cartilage and dense connective tissue. Alright, so we have talked about nose or nasal region. So any questions? Ada soalan tak? Before we go through to the next part, which is the pharynx. Okay. So basically dalam ni adalah nose lah. Naik ke belakang sikit, kita akan masuk dah nasopharynx, bahagian dalam. Lepas tu kita akan pergi ke oropharynx, larynx, trachea, sebagainya. Okay. Tak ada. So pharynx, bahagian pharynx ni adalah the part dekat kita punya throat tu lah. Okay. So it is muscular passages from nasal cavity to larynx. Okay, from nasal cavity to larynx, dia akan melalui part we call it as a pharynx. So pharynx, which is the part towards the nose, we call it as a nasopharynx. And the part to the mouth, we call it as a oropharynx. Three regions of the pharynx, we've got nasopharynx, superior region behind nasal cavity, and then we've also got oropharynx, middle region behind mouth, and lastly laryngopharynx, inferior region attached to larynx. So the part which will connect to the larynx, we call it as a laryngopharynx. Okay, nasopharynx connect to the nasal part, oropharynx connect to the oral part, okay, oral cavity part, where the laryngopharynx connect to the larynx part. The oropharynx and laryngopharynx are common passageways for air and food. Okay, so basically nasopharynx ni mainly for air passageways lah. Okay, but then in oropharynx and laryngopharynx, either we can use it for the air passageways for breathing, or also for the food digestion lah, untuk eating, macam the food also can the passage also can be used for food entry as well. So structures of the pharynx, auditory tubes enter the nasopharynx. Okay, basically in the nasopharynx tu, bahagian nasopharynx dia ada connection dengan kita punya auditory pathway as well. Okay, so auditory pathway tu, sebab tu sometimes when we've got cold or fever, flu, cold or fever, usually we will feel some what we call disturbance in our pressure inside. Okay, because when we got a common cold or flu, there will be mucus, a lot of mucus secretion inside our nasal cavity, and also in our sinus as well. So it will create some kind of high pressure there. So basically it will also affect our auditory tube as well, because there is connection between our auditory tube and also our nasopharynx. So that's the reason explains the different or feeling some pressure disturbances inside our nasopharynx cavity. Tonsil of the pharynx. Okay, in the pharynx we've got tonsil. Okay, pharyngeal tonsil, adenoids in the nasopharynx. Means tonsil ni dia adalah some kind of lymph node punya system lah, where it in I mean when we've got any kind of invasion of infection, bacteria, virus, so this tonsil will act as a first defense line of to counteract these microorganisms. Okay, so that's why when someone get fever, okay, common cold or any infection, it will also get, we call it as a tonsillitis. All right. Okay. All right. And then palatine and tonsils also, we've got three types of tonsils in the pharynx: pharyngeal tonsil, palatine tonsil, dekat atas lah, palate ni bahagian lelangit atas okay, dalam oral cavity bahagian atas lelangit itu kita palate. And then lingual tonsil. Lingual ni Latin punya word for the tongue. So tonsil tu ada tiga tempat: pharyngeal dekat pharynx tu lah, end of the nasopharynx; palatine tonsil dia dekat bahagian atas; and then we've got lingual tonsil at the base of the tongue. Okay, referred to the lingual itself lah, tongue. Okay, so tonsil ni macam saya cakap it acts as a apa nama it acts as a defense line mechanism, okay, to counteract any infection. Alright, and then in larynx also we've got a voice box, okay, where we create our sound, okay, when we talk, okay, the sound comes from the vibration of this voice box, okay. The roots air and food into proper channel, okay, plays a role in speech, made of 8 rigid hyaline cartilages and a spoon-shaped flap of elastic cartilage. We call it as a epiglottis. Okay, epiglottis ni adalah it is one of structure which mainly responsible, okay, dia ada dekat dua-dua tempat lah yang memisahkan antara food passageways and also air passageways. Okay, it means that if you realize that when we eat, okay, basically this the air passageways will be closed, okay, to prevent from the food to enter the respiratory passageways, okay, because if the food enter the respiratory passageways, our body will counteract with some kind of coughing or like to expel out the food, because when food enters the respiratory system, it can cause later infection or any what we call bad things lah, bad effects to the respiratory system. So it is very important for the epiglottis role of its function to what we call it to regulate, not regulate, to control, okay, in speech and also in food and air proper channel, okay. Alright, okay lah, so far okay ke?
Okay,
Okay, ada soalan? Tak ada
tak ada.
Alright, okay. Sekejap Alright, next. Okay, structures of the larynx. Okay, so basically, sekejap. Okay, structures of the larynx. Dekat larynx ni, kat bahagian uh, uh, where the respiratory passageways. Okay, we've got thyroid cartilage and largest hyaline cartilage, and also we've got here is a protrudes anteriorly hyaline cartilage. We call it Adam's apple, and then we've got epiglottis, superior opening of the larynx, roots foot to the larynx and air toward the trachea, and vocal cords. Okay, vocal folds vibrate is expel air to create sounds, pitch, and the glottis opening between the vocal cords. So basically, this is already explained. Okay, by previously, where I have explained regarding about the role of epiglottis in terms of how its important function to regulate or to control the food pathway and the air pathway. Okay, so to make sure that our body system can function in a proper way. Okay, so okay, here again, this is a nasal septum we've already discussed before. The particular plate, in the nasal septum, we've got a perpendicular plate here and a septal cartilage. Okay, this we call it as a vomit. And the pharynx, we've got three regions: nasopharynx, oropharynx, and laryngopharynx. Okay, so this is the epiglottis, which I have mentioned before. Okay, so here we can see how it controls the, 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 the passageways between the air and the food passageways. Okay, here is the hyoid bone. Okay, and then we've got thyrohyoid ligament from the thyroid cartilage to the hyoid bone. Okay, so thyrohyoid ligament, we've got ligament here, and then we've got laryngeal prominence. This is the Adam's apple. Okay, this is a larynx punya ni lah, punya anatomy. And then we got arytenoid cartilage. So basically, it is made form of cartilages lah. Cartilage is some kind of a flexible. Okay, so that's why uh, it's not hardened like a bone. Okay, it is much more softer, but then it is very important, especially to be flexible in the airway passage. And then we've got cricoid cartilage and cricotracheal ligament from cricoid to the trachea. Okay, this is a trachea, like a ring shape here we've got. And then the connection between the cricoid cartilage and trachea, we call it as a cricotracheal ligament. Okay, so here from the sagittal view, okay, here we've got a backpack here. This is a epiglottis I mentioned before. Okay, vestibular vocal cord. Okay, this is a vocal cord where we produce our sound. Okay, so this is arytenoid cartilage, arytenoid muscle, cricoid cartilage. Okay, and then tracheal cartilage from the uh, median punya view lah, atau sagittal view. This is from posterior, daripada belakang. This is from anterior, daripada depan. Okay, trachea is like a windpipe. Dia ada banyak ring. Okay. Connects larynx with the bronchi. So we have talked about pharynx. We have talked about larynx. Now we go to the next part, which is a trachea. Okay, trachea connects larynx to the bronchi. Bronchi actually dia dah masuk some part of the lungs punya system lah, ataupun punya area. So trachea connects larynx with bronchi, lined with ciliated mucosa. Okay, mucosa means that it's a very in cell tu. Ciliated means that it's like there is a hairy structure lah dekat cell tu. Okay, this imagine this is a tube. This is a trachea, and then lining inside the lining is got a squamous cell. Okay, and then the squamous cell got a cilia, which is some kind of macam ada cilia lah kalau belajar in microbe, in like a hairy appendages. Okay, the function of ciliated mucosa, beat continuously in the opposite direction of incoming air. Okay, ni macam untuk macam tu lah dalam tu, dia akan beat continuously in the opposite direction. Means if there is incoming air here, will in opposite direction. So expel mucus loaded with dust and other debris away from lung. It's like kita panggil nama dia filtration function. The filtration, it will filter any dust and any debris, okay, benda yang kotor, right? So in a form of mucus, okay. So basically when I mean the mucus that we expel out, okay, hingus ataupun kahak, is actually formation of debris and dust, okay, dirts, okay, to prevent it from entering the lung. So that's why when we've got common cold or we've got a flu, right, usually we will expel more mucus and more mucus lah, because of the infection actually have entered, and this cilia mucus actually have acted to prevent this from coming into our lung. Because once the dust or debris or any microorganism enter to the lung, we will get what we call as a pneumonitis or pneumonia, which is the complication is more severe, okay, because when lung get been infected, okay, means it has and it can and the respiratory function, the breathing system will be affected as well, okay. So that's actually what happen in COVID-19 infection, okay, where it go through attack to the bronchioles and alveolar, where there is an exchange of gases here, and when it disturbs the exchange of gases mechanism, so we will lack supply of oxygen, which will affect then in our circulatory system, our brain, and any other organs as well, because every organs need oxygen, okay, for metabolism, for respiration, internal respiration. So that's why it is very important, the first line mechanism, defense mechanism, okay, such as in this ciliated mucosa, to prevent from the much worse situation lah, if it is not prevented earlier. So walls are reinforced with a C-shaped hyaline cartilage, as we have seen before in the previous slide. Okay, lungs. Okay, and then we got the nasopharynx, oropharynx, we got larynx, and trachea, and then in lung lah. Seterusnya adalah lungs. Okay, lungs occupy most of the thoracic cavity, ataupun in Malay we call it as a paru-paru lah, paru. So apex is near the clavicle. I have shown it before in the superior portion, while its base rests on the diaphragm, okay, inferior, the portion yang bahagian bawah. So each lung is divided into lobes by fissures. Okay, if you realize that there will be some like line ni dekat lung tu, there ada line. Okay, this line will separate upper portion and lower portion. This line we call it as a fissures. Fissures ni macam you ambil satu paru-paru, kalau siapa pernah tengok paru-paru lembu ke haiwan ke, dia macam ada fissures. Fissures ni dia macam kita panggil Allahumma salli ala Muhammad wa ala Muhammad, dia macam longkang lah, macam longkang kecil macam tu. That is a fissures lah, which divided into parts of the lungs lah. Left lung we've got 2 lobes, while the right lung we've got 3 lobes. So covering of the lungs. So lungs ni dia ada covering dia, okay. Covering dia ada 2, okay. Dibayangkan yang ni adalah lung, alright. Ni lung, and then the outer side ni adalah kita punya rib cage, which form of the intercostal rib bones and also the intercostal muscle. Okay, ini adalah intercostal cage, dalam ni ada lung. Okay, betul-betul lapisan yang berada di lung ni, okay, ini lung, luar dia ni, betul-betul kat luar dia ni, okay, we call it as a visceral pleura, which is pulmonary visceral pleura, or visceral ni means organs lah, covers the lung surface, yang cover betul-betul lung surface. Macam plastik tu betul-betul lekat dekat lung, covering tu betul-betul lekat dekat lung tu, that is a visceral pleura. Parietal pleura lines the wall of the thoracic cavity. Okay, yang ni lung, betul-betul luar dia tu adalah visceral pleura. Okay, bahagian yang lining dekat thoracic cage, dekat rib cage, rib bones and muscle tu, okay, that is the we call it as the parietal pleura. Okay, so antara dua-dua ni, pulmonary visceral pleura and parietal pleura, they will what we call as a pleural fluid fills the area between layers of pleura to allow gliding. So the movement of the pleura tu, it will be like a very smooth movement lah, no friction, because there will be some fluid inside there. Okay, macam ni this is a lung. Alright, this is a lung, and then here outside we've got cage. Okay, this is a cage. Right, the yellow one is the cage. Okay, so the blue one here is the, okay, which lining the lung. This is a visceral pleura, pulmonary pleura, while this one here, it is a parietal pleura. Okay, and then inside here, okay, so inside here, right, this is a fluid, okay, between the parietal pleura and visceral pleura. Okay, this fluid, we call it as a pleural fluid. Right, okay, so boleh faham daripada nasopharynx hingga ke lungs. Any question before we go further? Ada soalan ke?
Tak ada.
Tak ada, alright, good. Okay. Okay, this one is the view from daripada apa nama dia, daripada atas lah. Okay, daripada atas, this one is the posterior part, anterior part. When we do a cut section, this is what we see in the lungs. Okay, this is the right lung, left lung, okay, ribs, okay, covering thoracic cavity. Okay, and then we've got parietal pleura, okay, visceral pleura, as I mentioned before, and then pleural cavity. Inside the pleural cavity, we've got pleural fluid, okay, right primary bronchus, and then artery, vein, sternum here, okay. Okay, this pulmonary artery and vein are coming from the heart. Okay, pulmonary artery from the heart and to the lungs. Okay, where it carries the carbon dioxide, we call it as a pulmonary artery. Okay, a pulmonary artery lah. Okay, well daripada lung, okay, then there will be exchange of gases. Okay, so daripada lung, from lung to the heart, then we call it as a pulmonary vein. Okay, so pulmonary vein will be filled with the oxygen. Okay, so it will bring the oxygen to the heart, and the heart will distribute all of this oxygen to the entire body. Okay, so heart here in the mediastinum, alright, then pulmonary trunk, okay, body wall, left lung, root angles of lung, esophagus lah, belakang dia, posterior mediastinum. Okay, this is what I call as a fissure. Ini adalah fissure tu. Okay, and this is apex. In the left lung, dia ada notch to occupy the heart. The heart. So kita sebelah kiri kita ada heart. So ada some notch here in the left lung. Okay, so from inside, from the medial point of view, medial view, There's a pulmonary artery here and a pulmonary vein. Okay, if you realize that kalau kita perasan kalau kat tempat lain vein ni adalah yang membawa uh, kita panggil carbon dioxide, while artery will bring the oxygen, as we have discussed in cardiovascular system previously. Okay, but in the between the respiratory and heart punya connection, punya system ni, okay, artery ni akan bawa carbon dioxide, while vein ni adalah in pulmonary. Kalau vein sebut pulmonary vein, it will bring the oxygen, while pulmonary artery it will bring the carbon dioxide. So basically vein and artery ni adalah merujuk kepada artery, which means that it comes from the heart. Maknanya daripada heart pergi ke tempat lain, calls it as a artery, while vein adalah yang pergi ke heart, yang pergi ke heart, maknanya bawa daripada tempat lain pergi ke heart, right? Tetapi disebabkan pulmonary function ni adalah exchange of gases, okay, daripada heart tu ke lung sahaja yang berlakunya exchange of gases, carbon dioxide akan tukar kepada oksigen. Maknanya expel carbon dioxide, bawa masuk oksigen. Kalau dekat badan tisu kita yang lain, heart ni dia akan bawa darah oksigen, expel oksigen bagi dekat tisu, tisu yang akan bagi carbon dioxide dekat blood tersebut untuk bawa kepada heart, heart akan bawa kepada lung. Okay, so basically that's why we can see in pulmonary artery, it is bluish in color because it is filled with carbon dioxide, but in pulmonary vein carbon dioxide ni ada exchange dengan oksigen yang dibawa daripada lung. Okay, in pulmonary vein, that's why we can see the pulmonary vein is reddish in color. Okay, differs with other vein and artery inside our body. Okay, the color is different. Okay, artery will be reddish in color. Okay, while vein is bluish in color because it is purely coming from heart to the entire body except the lung. Okay, alright. Okay, primary bronchi. Okay, so daripada trachea tadi, dia akan pergi kepada bronchus. Bronchus is a singular. Kalau ada banyak bronchus, we call it as a bronchi. Dia punya plural dia. So this formed by division of trachea. Okay, trachea tu dia akan bagi kepada dua. Okay, dua tu kita panggil bronchi. Dua-dua. Enters the lung at the hilus. Okay, right bronchus is wider, shorter and straight than left. Okay, a bronchus subdivide into smaller and smaller branches. Okay, branches. Okay, so bronchi ni dia akan jadi bronchioles. Okay, makin kecil tu dia akan jadi bronchioles. Dekat hujung bronchioles tu lah yang ada alveolar duct dan alveoli yang sac lah. Okay, so ada beza. There is a difference between right bronchus and left bronchus, while the right bronchus is wider, shorter and straighter than left. Okay, respiratory divisions. So bronchi ni kita ada primary bronchi, then secondary bronchi, tertiary bronchi, and then bronchioles, bronchial or terminal bronchioles. So divisions dia tu sampai tertiary, sampai kali ketiga, and then baru ada pergi ke bronchioles where there is a alveolar sac here. Then alveoli where there will be an exchange of gases lah between oxygen and carbon dioxide. So bronchioles, smaller branches of the bronchi, all but the smaller branches have reinforcing cartilage. Okay, terminal bronchioles end in alveoli. Okay, so end of bronchus there will be bronchioles. Okay, so end of bronchioles there will be the terminal bronchioles, and then with the alveolar duct here. Okay, macam ranting ni, and at the end of the duct there is alveolar sac. Okay, alveolar sac. Inside the alveolar sac ni, okay, there will be lining of capillary lah, daripada heart tu, where it will bring inside the blood. Inside the blood there will be hemoglobin. Okay, to exchange gases between the carbon dioxide and oxygen. So oxygen mainly when we inhale the oxygen, okay, inspire the oxygen here, Okay, it will go through all these bronchial, terminus bronchioles, the alveoli until here in an alveolus. Okay, there is a capillaries here. Okay, blood vessel here, exchange of gases between all this oxygen will go to the blood, and the blood will exchange carbon dioxide back to this alveoli, and then we expel out this carbon dioxide. Okay, and exhalation, and that's how inhalation and exhalation occur, respiratory mechanism. So respiratory zone, okay, tadi structures, kita ada respiratory bronchioles, alveolar duct and alveoli, and then the site of gas exchange lah. So alveoli, structure of alveoli, the alveolar duct, alveolar sac, alveolus, and gas exchange. Okay, alright, this is what we can see inside the alveolar sac, alveoli tu. Okay, it is a very thin squamous epithelial lining of alveolar walls. So alveolar tu dia very ada, kita panggil squamous epithelial lining lah. So inside ni kalau kita buat cross section here, okay, ada nampak ada blood vessel dalam tu, blood vessel coming from the pulmonary artery which comes from the heart. Okay, so ada inside tu ada RBC, ada red blood cell which carry the carbon dioxide first lah. Okay, and then so this is a RBC, capillary darah. Okay, you can imagine that. And then this is a alveolus. Okay, so carbon dioxide ni dia akan exchange dengan oxygen. So carbon dioxide will go to this alveolus, while oxygen from the alveolus will go to the blood. Okay, so and then this pulmonary vein, okay, will go back to the heart, and heart will pump all of this oxygenated blood to the entire body, while this carbon dioxide, okay, then will be expelled out, exhalation of respiratory mechanism. So gas exchange, gas crosses the respiratory membrane by diffusion, oxygen enters the blood, carbon dioxide enters the alveoli. Okay, there is also macrophages there to add protection. Okay, and surfactant coats gas exposed alveolar surfaces. So events of respiration. Okay, so it summarized, okay, what I have explained before, and so actually they divide it into 4 events of respiration here. Okay, first we call it as a pulmonary ventilation, where there will be this is in an order lah, dia punya dalam urutan yang betul. The first, pulmonary ventilation, means that ventilation, exchange of gases which occur in our lung. Right, so moving air in and out of the lungs. Okay, and then external respiration, where there is a gas exchange. First we have to move air inside, okay, and also moving out the air outside lah, oxygen masuk, carbon dioxide keluar. And that external respiration, okay, so the air which consists of the oxygen, there will be exchange between the pulmonary blood and alveoli, okay, exchange of gases. And then respiratory gas transport of oxygen on carbon dioxide via the bloodstream. Okay, and then internal respiration, mean gas exchange between blood and tissue cells in systemic capillaries. Okay, bila oxygen inside our blood tu have been transported from the heart to the entire body, so each cell, okay, they will have the mechanism of internal respiration, where they will get the oxygen and they will expel out the carbon dioxide. Okay, so any question about the events of respiration and also the anatomy from the pharynx until bronchioles, capillaries? Faham ke? Boleh faham? Okay,
Boleh.
alright. So mechanics of breathing, pulmonary ventilation. Okay, how actually we create a pressure inside our body. Okay, basically gases ni dia moving from kita panggil positive pressure to the negative pressure. Okay, daripada difference pressure tu barulah akan ada daripada tempat yang banyak ia akan pergi tempat yang kurang. Okay, from the accumulated places it will go to the empty spaces, macam itulah, lebih kurang. So to make sure that the gases outside can enter inside our body, we have to create some kind of negative pressure inside our body so that the gases can enter into the airway passages lah. Okay, so it is completely mechanical process. It depends on volume changes in the thoracic cavity. Volume changes lead to pressure changes, okay, which lead to the flow of gases to equalize pressure, okay, which I have explained before. So there are two phases. First one, we call it as inspiration, flow of air into the lung, and then expiration, air leaving the lung. Okay, first we go to the inspiration. Okay, take note, this is very important topic. It is a very important subtopic. Okay, diaphragm and intercostal muscle contract. Okay, this is a diaphragm. Okay, here. Okay, and then a diaphragm, the lower part of below the lung. Okay, so when it contracts, okay, basic, and it contracts, and also with this intercostal. Inter means between, intercostal, costal means the rib cage ni lah, intercostal muscle. So this muscle between this rib cage ni, okay, when it contracts, okay, ribs elevated, eh, and then diaphragm moves inferiorly, okay, so it will create here, okay, the movement of both this intercostal muscle and diaphragm, okay, will create this external air is pulled into the lungs with the increase in intrapulmonary volume. Okay, they create some pressure where the gases from outside can enter the lung, okay, and then gas exchanges can occur lah. Alright, so basically it will increase the size of thoracic cavity, and then that's how the external air is pulled into the lungs due to an increase in intrapulmonary volume. Okay, changes in lateral dimension, we call it a full inspiration lah. Okay, due to these two components. Okay, and then in exhalation, okay, exhalation, it is kind of a different story. Okay, largely a passive process which depends on natural lung elasticity. Okay, we do not contract anything. Okay, lung ni dia ada properties of elasticity. Means elasticity, it will go back to its original position. Okay, tadi kita dah kita panggil dah create a large volume to make sure air can masuk dalam tu, and then bila dia akan mengembang, automatically it will passively lah, maknanya kita tak apa-apa letakkan any exertion or any kita panggil usaha untuk mengecilkan dia, dia akan mengecil dengan sendirinya. Automatically it will shrink its size, okay, because obviously like apa kita panggil getah, getah bila kita renggangkan, bila kita lepas dia akan pergi ke posisi asal semula. That's how lung works lah. Okay, so elasticity of lung, when it expands, automatically it will try to return to its normal size. Okay, so because of this lung elasticity, masa relax, air is pushed out of the lungs. Okay, air tu akan keluar, and that's how exhalation occurs lah. However, we can also force expiration. Okay, kita boleh force, kita nak expire forcefully pun boleh. Tapi bila kita force expiration, it is not a passive process lah. It is active dah. Maknanya kita dah ada kerahkan some intercostal and also contraction lah, muscle. Okay, mostly by contracting intercostal muscle to depress the rib cage. Okay, so basically in a normal breathing, okay, the exhalation occur because of the passive process depends of natural elasticity. Okay, but then it is forced expiration can occur mostly by contracting internal intercostal muscle to depress the rib cage. So it's very important to know how inhalation and exhalation occurs. The key points there, what type of muscles and organs involved in this inhalation and exhalation. okay, which are the intercostal muscle and the diaphragm. Number two, okay, in inhalation exhalation, you have to mention about the in inhalation, it is an active process where the contraction of the muscle and diaphragm itself, okay, it will create a larger thoracic cavity, then air can enter inside and can enter the pulmonary cavity lah. While in exhalation, you have to mention the key points here that is the lung elasticity, okay, where it is a passive process, not an active process. This is a difference between inhalation and exhalation. But there is some exception here. In a forced expiration, okay, there is in contraction of internal intercostal muscle to depress the rib cage, where this is an active process lah, because there is a contraction of the muscle. Okay. Okay, non-respiratory air movements can be caused by reflexes or voluntary actions. Okay, this is kita panggil reflexes lah, yang berlaku. Air movements pun boleh berlaku, can occur, okay, without we voluntarily, maknanya kita tak initiate pun, such as in cough and sneeze, okay, clear lungs of debris, laughing, crying, yawn and hiccup. Respiratory volume and capacities. Okay, there are some division, or not division lah, kita can divide it into in our lungs, the differences between when we force expiration or force inhalation, maximum inhalation, so it will affect the air volume inside our lung. Okay, normal breathing moves about 500 milliliter of air with each breath tidal volume, amount of air that moves in or out of the lungs with each respiratory cycle. This is a normal breathing, like we have like we are breathing right now. Okay, basically there is about 500 milliliter of air lah, okay, moves inside and outside. Many factors that affect respiratory capacity, okay, a person's size, male or female, age and physical condition. Residual volume of air after exhalation, okay, about 1.2 liter of air remains in the lungs. Okay, means even in the normal breathing, when we exhale, okay, basically there are some still residual of air present inside our lungs. Okay, there is a residual air volume. In inspiratory reserve volume is the amount of air that can be taken if forcibly over the tidal volume, okay, usually between 2.1 and 3.2 liter. Expiratory reserve volume is the amount of air that can be forcibly exhaled, approximately 1.2 liter. So the key words here is a forcibly. Okay, this is not normal breathing, where we use extra effort, okay, to something like that. Where expiratory, this is not normal breathing, but we use some exertion and what we call efforts to do that. And then residual volume, air remaining in lung after expiration, about 1.2 liter. Okay, so we've got also vital capacity, the total amount of the interchangeable air. So vital capacity basically is the amount of summation of the tidal volume, IRV and ERV here, inspiratory reserve volume and expiratory reserve volume. Okay, so how many air exchange during the process, what we call as a vital capacity. And also we've got the dead space volume here, air that remains in conducting zone and never reaches alveoli. Okay, this is a memang air yang ada dalam tu, tak terlibat pun dalam exchange of volume. Functional volume air that actually reaches the respiratory zone, and respiratory capacities are measured with spirometer. So basically all of these air volume can be measured by, call it a spirometer. Okay, so in this just know the definition je lah. Okay, so this is we have I have explained before the previous slide. So this is a residual volume, where after exhalation the residual air that still present inside our lung, we call it as a residual volume. Expiratory reserve volume, This is a tidal volume, the normal breathing. Okay, this is normal breathing. Inspiratory reserve volume, possibly inspiration. This is a possibly expiration. So vital capacity is the exchange of gases can occur. Okay, and then this is a total lung capacity lah. So if we do a summation all of this capacity of lung, totally we can have about 6 liter of air lah inside our lung. Okay, respiratory sounds are monitored with a stethoscope. Okay, which is usually done by the doctor. Okay, to check our normal sound of breathing. Okay, so bronchial sounds are produced by air rushing through trachea and bronchi. If we put this stethoscope here, alright, in the bronchus part, okay, the sounds like a hollow sound. Maknanya macam awak tiup bunyi yang ada tiup ke tiup dalam straw ke benda yang hollow benda yang uh, tiup lah awak tiup dia akan bunyi ada certain bunyi kan bunyi angin yang laju melalui tempat yang sempit, bronchial sounds lah. Okay, while vesicular breathing sounds soft sounds of air filling alveoli, macam bunyi dalam air kalau awak masukkan udara macam ambil straw lepas tu hembuskan dalam air dia akan bergelik-gelik macam tu kan. So this is a vesicular breathing sounds. So basically this is not normal sound lah. I mean, when we've got kita panggil paru-paru berair ke ataupun any inflammation of lungs, okay, there is some kita panggil inflammation there. So the sounds could be something like that. In asthmatic patient also we can hear the bronchial sound because the airway passage airways tu dia dah mengecil dia dah narrow, so bunyi dia tu lagi kuat. So that's how the doctors can know either you have a normal respiration or not, and this abnormal respiratory sound, okay, reflects the condition of the bronchus and the lung itself lah. Okay, and that's where they will then advise you to do the lung X-ray to see to diagnose the disease. Okay, so basically this is how we can know in first in early stage in a stage in a earlier dalam masa yang awal-awal untuk nak tahu you ada any symptoms and signs of lung infection or not. Okay, external respiration. Okay, this is events of respiration that I have mentioned before. Okay, so we go through again, but in a to revise. Okay, external respiration is oxygen movement into the blood. Okay, external and internal kan dalam events of respiration tadi. So external respiration tu oxygen movement into the blood. The alveoli always has more oxygen than the blood. Oxygen moves by diffusion towards the area of lower concentration. Pulmonary capillary blood gains oxygen. Carbon dioxide movement of the blood. So all of these actually occur at the alveoli. Carbon dioxide movement out of the blood. Blood returning from tissue, higher concentration of CO2 than air in the alveoli. Pulmonary capillary blood gives up carbon dioxide. Blood leaving the lungs is oxygen rich and carbon dioxide poor. This is an external respiration. And then from the external respiration ada exchange of gases berlaku dah, and then gas tu transport pun di dalam circulatory system. Okay, oxygen transport in the blood inside the RBC attached to hemoglobin. So bila dia dah attach dengan hemoglobin, dalam blood tu ada RBC. Kita dah belajar di endocrine system. Okay, erythrocyte, we call it as a oxyhemoglobin lah kalau dia dah attach dengan oxygen. A small amount is carried dissolved in the plasma. Carbon dioxide transport in the blood. Most is transported in the blood plasma as bicarbonate ion. Okay, a small amount is carried inside RBCs on hemoglobin but at different binding sites than those of oxygen. Okay, carbon dioxide ni selalunya daripada tisu, oxygen ni daripada heart. Okay, so dia jumpalah. Selalunya oxygen ni dia akan transport melalui artery, carbon dioxide ni akan melalui vein. Okay. So then sampai je dekat tisu ada internal respiration, exchange of gases between blood and body cells, an opposite reaction to what occurs in the lung. Okay, lung tadi terbaliklah, oksigen masuk dalam darah, carbon dioxide keluar daripada darah. By internal respiration, oksigen masuk dalam keluar daripada darah, masuk ke dalam tisu. Okay, carbon dioxide keluar daripada tisu, masuk dalam darah untuk bawa pergi balik ke heart, heart pergi ke lung, exchange of gases, lung pergi ke heart semula, heart dapat oksigen balik dan pergi balik ke tisu untuk exchange of gases occur. So there is a cycle lah there. Okay, so carbon dioxide diffuses out of tissue to blood, oxygen diffuses from blood into tissue. Okay, so this is actually occur in the external respiration, and this is an internal respiration. Okay, in external respiration, gases exchange to opposite lah dengan internal respiration. By external respiration, the oxygen will go to the blood, and while carbon dioxide will expel from the blood. While in the internal respiration, oxygen will expel from the blood to supply the tissue, and then carbon dioxide will go to the blood, expelled out by the tissue. Okay, external respiration, gas transport, and internal respiration summary. Okay, so basically the summary here, macam mana berlaku, kita ambil oksigen, okay, kita inspired, banyak oksigen, so masuk dalam darah, masuk dalam lung, oksigen ni banyak, and then dia akan pergi sampai ke hujung alveolar sac. Okay, oksigen ni akan exchange dengan carbon dioxide yang ada dalam pulmonary artery ni lah. And this is a pulmonary artery. Okay, alright, so ada exchange of gases, keluar carbon dioxide, masuk oksigen, okay, dekat belah sac. So this is a pulmonary vein. Pulmonary vein, nampak tak pulmonary vein? Reddish in color. Pulmonary artery bluish in color. Okay, and then pergi je dekat heart. Okay, heart ni akan pump ke seluruh badan. This is a artery, not pulmonary artery. This is a artery, common artery. This is a common vein. Tapi artery ni dia dah jadi oxygenated. Yang ni pulmonary vein, yang ni artery daripada aorta ni artery pergi tempat lain, semua badan body tissue. Okay, nampak oksigen still banyak lagi. And then sampai dekat tisu, oksigen akan pergi ke tisu. Tisu akan expel carbon dioxide masuk dalam darah semula. Okay, so the carbon dioxide akan tinggi lah, oksigen akan kurang. Alright, so this is a vein. Jadi kita ada veins. Pada veins tu akan pergi ke vena cava. Vena cava tu akan masuk ke heart semula. Okay, dekat right side of the heart. Okay, and then pergi ke pulmonary artery. Pulmonary ni nama dia pulmonary artery. Okay, and then pulmonary artery akan ada tinggi carbon dioxide. Okay, and then exchange of gases pun berlaku semula. So that's how the exchange internal respiration, external respiration, gas transport occur. Okay, in summary. So neuroregulation of respiration. Alright, activity of respiratory muscle is transmitted to the brain by the phrenic and intercostal nerve. Neurocenters that control rate and depth are located in the medulla. The pons appear to smooth out respiratory rate. Normal respiratory rate, we call it as the apnea, is the 12 to 15 respiration per minute. Hyperapnea is increased respiratory rate, often due to extra oxygen needs. Okay, so basically yang kita kawal benda ni adalah daripada phrenic nerve ni lah, yang dikawal oleh brain. Okay, kedudukannya adalah dekat medulla. Alright, breathing control center. Okay, so kita nak gerakkan benda-benda ni, intercostal muscle dan diaphragm ni kena ada impulses from the brain lah, maknanya arahan daripada brain. So nerve yang terlibat ni adalah intercostal nerve. Okay, dia punya nucleus dia ada dekat pons and medulla ni. Okay, alright, macam mana dia nak tahu gas tu kurang ataupun tak? Ada daripada kita panggil O2 sensor in artery dekat aortic arch ni. Dia boleh detect oksigen kita kurang ke, banyak ke, and then that's how it can give an information to the brain, and brain can act, and it will give then information feedback to the intercostal muscle and then diaphragm, and that's how we can initiate the breathing movement lah, sama ada nak tingkatkan ataupun nak kurangkan, alright, based on the oxygen level inside our blood. So factors influencing respiratory rate and death, okay, physical factors, increased body temperature, exercise, talking and coughing, volition, conscious control, emotional factors, okay, chemical factors, oxygen level, changes in oxygen concentration in the blood are detected by chemoreceptor. Nama receptor tu yang dekat aortic arch tadi tu adalah chemoreceptor. Information is sent to the medulla oblongata. Okay, carbon dioxide level of carbon dioxide in the blood is the main regulatory chemical for respiration. Increase carbon dioxide, increase respiration. Changes in carbon dioxide act directly on the medulla oblongata. So basically, the first sensation ataupun the detection tu actually occurred in the aorta ni lah, and then from the oxygen and carbon dioxide level, and then it will give instruction with the brain either to increase or decrease the respiration rate lah based on the oxygen level, which is detected by the chemoreceptor. So respiratory rate changes throughout life. Okay, different phase of life, throughout our life. Okay, either when we are newborns, infants, and then children, adults. Okay, so the respiratory rate is also different lah. The normal rate in newborns 40 to 80 is considered normal. Infants, and then regularly it will decrease. At infant 30, children 25, adults 12 to 18 respiration per minute. Rate of increases somewhat with old age. However, kita akan pergi semula pula kepada keadaan asal tinggi bila kita dah tua. Okay, so basically that's why we can see in infants atau baby yang baru lahir, kadar dia punya pernafasan itu agak laju berbanding dengan orang dewasa. Alright, so next chapter is the digestive system. So any question, ada soalan tak regarding the respiratory system? Okay, in summary, the important part that you have to know is about the anatomy first. Okay, from the nasopharynx, oropharynx, larynx, trachea, bronchioles, alveolar sacs. Okay, and then the events of respiration. Okay, external respiration, gas exchange, internal respiration. Okay, and then also the mechanism of breathing, inhalation, what actually occurred. Okay, what type, so either active or passive mechanism, what kind of muscles involved, diaphragm, and exhalation as well, how either it is a active or passive mechanism, role of elasticity of the lung in aspiration, and also we've got forcibility aspiration, and alright. Okay, so I think that's the important key points lah in this subject, in this topic, chapter respiratory system. So any questions? Ada soalan tak? Apa yang tak faham? Anyone? Semua faham Dengar ke tak ni? Dengar. Okay, so I do really hope that all of you can understand this topic, because I give a clue this topic will akan keluar dalam peperiksaan exam. Alright, so you have to study hard about this topic. Respiratory system. Another thing is, in the respiratory system you will counter many diseases about the respiratory system in occupational diseases, such as asbestosis in the lung cancer, or smoking leads to the lung cancer as well. Okay, pneumonitis, even in COVID-19, it relates very much to the respiratory system. So if you do not know very well the anatomy and how our lungs work, the exchange of gases for respiration, so when you read about article about how COVID-19 affect our respiratory system, lung failure, so you cannot have an idea about the mechanism, how it happens actually. So the basic that you have to know is the anatomy and physiology of the respiratory system, and from that you can further understand about the more deeper understand about the disease, especially in the occupational health and disease lah, specifically in the respiratory system. Okay, alright. So the password for attendance today is one. Okay, so all of you can mark your attendance in column as usual in chapter 6. Okay, I have written I have put the attendance column there. Okay, I think that's all. Alright, so I will okay, that's all. Thank you very much.